Hi Stonington, thanks for tuning in again. We're really excited to have Peter Brenny here with us today to share a little bit about an amazing organization that he helped get started at the start of COVID. And we want to be sure people in the community know that it's here, what it can do for them, and just thank you for coming in right after Thanksgiving. So thank you, Peter. Do you want to start by telling us a little bit about S.H.A.R.E?
Sure. Well, S.H.A.R.E stands for Stonington Helps Area Residents in Emergency. And of course, the emergency that got us started was the COVID pandemic. And we looked at what the needs were. The obvious one from the beginning is that people didn't have any masks. It was a really big shortage. And nursing homes were the hardest hit. So altogether, we've distributed almost 1,000 masks. Mostly at the beginning of the crisis when they were lacking. We distributed some, I think 300 at the beginning of the school year with free lunches, and just a very few that were left over recently to feeding centers, homeless shelters and things like that. But what I wanted to talk about today is our program of contactless deliveries to your home for people who are vulnerable to COVID-19, people who are over 60, and each age cohort after 60 has really sharply increased death rate. 60s are dangerous, 70s more so, and so on. The people who make these deliveries are younger, healthy volunteers. Why take these deliveries? Obviously, the age vulnerability, health conditions like diabetes or prior lung problems are a good reason to stay home. There have been some very good recent studies. One I think involved cell phones out of the Midwest, and what they found is that 80% of the new cases, or 80% of cases that they studied were contracted in crowded indoor areas. So if someone does your grocery shopping for you and gets you out of stores, you are reducing crowding. And I like to say that you're not being weak, you're not relying on charity. You are contributing to the safety of the community as much as the volunteers who serve you by staying home, staying out of crowded places. I should just mention that a lot of people are complacent about being in Stonington, thinking, well, we've escaped this. In the last 2 weeks, there were 60 new cases in Stonington, and a pretty high positivity rate. In other words, of the people who were tested, what's the percentage who had it? 2 weeks ago, I think it was 6.3%. This 2-week period, I think ended today, was over 5. And people are shocked to find that somebody living right next door to them has it, because there's no announcement, there's privacy. You don't know who has it. A lot of people who have found out, for example, from the local newsstand, are quite shocked to find that somebody next door has it. So again, the reason to do this is to stay out of crowded places. I forgot to mention quarantine. Obviously, if you have the disease, or you've been told that you should quarantine because you've been in contact with somebody who has it, absolutely all the more reason to stay home and have a volunteer get what you need. Okay, so what do? How does it work? We arrange contactless deliveries. That means people leave stuff at the door. That could be groceries, it could be medicine, it could be a book from the library. We do this in a very careful way from the health point of view, and the volunteers get very strict instructions that they are obviously let us know immediately if they have any exposure problem, and they take all kinds of sanitary precautions in the delivery. How you pay for it? You know, if you have one of these electronic payment systems like Venmo or PayPal, and you can both get the app, that's fine, that's completely contactless, but not everybody is handy with this electronic stuff. So, you know, you can leave a check or cash or something. You work it out with the volunteer. And if you want, the volunteer will just check in on you and see, you know, how are you doing if you're living alone. We don't provide that service by itself, but if you're getting the deliveries, we do it. We don't give rides, things like that, because this is it's supposed to be contactless delivery. We do try to be flexible. For example, you know, filling in part-time if your family or friends helping you are overstressed. That's about it. The way we match you is we try to find someone in your neighborhood, and we match you online, and we notify you, you know, you've been matched with X person. If you want to get the service, you can go to our website, which is stoningtonhelps.com, or again, you know, not everybody has access to the web, so you can call 800-827-4158, and we hope that the people should take advantage of this well.
So Peter, that's a great point you brought up about the volunteers and being in, trying to match them around neighborhoods. For people who are maybe a little bit weary of trusting strangers, could you tell us a little bit more about how S.H.A.R.E kind of vets or looks at volunteers?
Yeah, sure. That was certainly a question that we looked at very hard in the beginning of the program. Our program was modeled on a very successful one in Oakland, and what they do is they call up people who volunteered. They talk to them and get an impression of who they're dealing with. They see if they have a presence online in the community, and obviously, you know, they told me a story. Some guy named Cat with no last name and no address doesn't get to be in the program. But you know, Oakland is a big urban area with all kinds of people, and they just have not had trouble with it. We're in Stonington, so we really do rely on people's goodwill. There's a disclaimer for legal reasons, but I don't have doubts about the people who volunteer. A lot of them, first of all, we try to find people in the neighborhood. Probably not going to steal your bicycle and then be seen around with it in the neighborhood. We do also, with single people, if you're a single woman, we will match you with a woman, and so on. And I noticed many of the people who volunteer, they sound really eager to help. Some of them, quite a few of them are in helping professions like nurses, teachers. So I feel pretty good about our volunteers.
No, that's great that you guys do so much, and I guess just the timely matter, just this morning we got an emergency update from Rhode Island saying their hospitals are at capacity and asking people to please do everything they can to stay home and stay put for the next few weeks to get through this tough time. So I think, you know, we're just right on the border here, so I think this is really timely, and like you said, there's no shame in asking for help. It can actually be a great asset to contribute by staying home and asking for other people to go out and reduce the number of people in the stores. So hopefully some people will take you guys up on it, and I know the mask distribution was amazing. You guys got masks to so many facilities around the area.
Well, it was, there are so many people involved in this that I don't know all of them, and the amazing thing, or the really encouraging thing is how many people in this town are willing to volunteer and have. So that's, I really feel good about that.
Oh, good. Me too. Well, Peter, thank you. Thank you to everybody at S.H.A.R.E. Like you said, it's a big volunteer effort. So thank you to all of you who've done this.